So I had been putting out big round bales of hay with my tractor, and in getting out of the tractor or off of it, I twisted my right hip. It continued to hurt for several days. I wound up in the ER. Dr. Obi, when I got back, he set me up with Dr. Kumar to have the Watchman consideration for it. And then I went to Dr. Kumar, and he examined me, did the preliminary stuff, and set me up for the surgery. And I've been tickled to death with it ever since, because I can pretty well do anything I want to do and not have to worry about it. One thing they did tell me, though, that I was very lucky to even be there, because if I'd have hit my head or something internally, I wouldn't be here. Since then, I feel much more comfortable at doing anything and not worrying. I was afraid to do a lot of things because I was afraid I would hit my head or do something or get a bad cut.
Well, Mr. Smith has a history of atrial fibrillation, which is the most common heart rhythm disorder in the world. And it's the most common arrhythmia that we treat as cardiologists, which puts patients at risk for stroke, because you can form clots inside of your heart. He was unable to take a blood thinner to prevent himself from having a stroke because he had a traumatic fall earlier in the year. And so we had a discussion with Mr. Smith to offer him an alternative to his blood thinner that he had been taking for several years. And that could do the same thing as a blood thinner, which is prevent his risk for stroke. And so we discussed proceeding with a left atrial appendage occlusion device, better known as the Watchman. We started performing left atrial appendage occlusion here at United Regional in July of 2024. The Watchman procedure is a minimally invasive procedure where we puncture a small vein in the groin and we make our way up to the heart, and we find the area known as the left atrial appendage, which is a small pocket that can form blood clots. We then measure the size of that area of the heart and then pick the appropriate size device, which is the Watchman itself. This is actually an actual Watchman, and this is a 14 millimeter device. They go anywhere from 14 to 40 millimeters depending on the patient's anatomy. And then we are able to go into the heart and cross over from the groin, cross over to the left side of the heart. This is the small pouch that collects the blood clots. We are then able to, after determining the size of this pouch, deploy a Watchman inside that so that it completely seals off that area.
I was real impressed with Dr. Kumar. He was very easy for me to understand, and he was very good at explaining everything, what was going to happen, what would happen after. It made me feel, at ease. I had been apprehensive and nervous before it because I didn't know actually what was involved. I would like to thank Dr. Kumar and Dr. Obi both for their care and their immediate attention to things, and the staff here at United Regional and everybody we've dealt with here has been just great.
It was very important for Frank to consider this as an alternative to blood thinners because he has a very active lifestyle, and the fact that he would continue to be at risk for stroke but also at risk for having an event like what happened to him earlier in the year had he not considered this. The ability for him to do all of those things without having him worried about what could come as a consequence if he were to injure himself gave him the peace of mind that he needed to continue to live his life fully. And so being able to bring the entire suite of cardiovascular care to our patients here at this hospital is really a remarkable thing that we're able to offer our community. I would advise our patients or anyone in the community who has a history of atrial fibrillation and who has to be on a blood thinner but cannot take it for some reason or has had a significant event on the blood thinner to talk to their physicians and see whether or not they would be a good candidate for left atrial appendage